Hello, my name is Baiba Ziemele. I am from Latvia and I have Willebrand disease. Probably you have never heard of this bleeding disorder before because hemophilia is the best known bleeding disorder and all efforts usually go to stop internal bleeds and in joints and muscles for them. But we have similar symptoms and way less treatment options or even education about this disease, which may affect up to 1% of population. Our symptoms can change over time, and we never know what to expect, just a bruise or bleeding in a joint. This disease has many types, and therefore it is hard to recognize, diagnose, and provide treatment. We speak so much about treatment because that allows us to stop and prevent bleeds and therefore live normal lives. I have a wonderful family. My parents had no idea the bleeding problem my dad has could ever be inherited. We lived happily together with all the struggles young families had at that time. When my brother was born, my sister fell down the stairs and had a huge hematoma under her eye, which needed a surgery. Only after she started bleeding repeatedly, doctors thought something is wrong with our blood. They said all three of us have to be tested. All the efforts to do proper tests failed in 90s. You might think that testing possibilities have improved over past 30 years, but that is not so, at least not in Latvia. This year, we finally had global guidelines for diagnosis and treatment of von Willebrand disease. So far, less than 10 patients have received diagnosis of their von Willebrand type recently. Only 1 in 5 possible patients are actually diagnosed with von Willebrand here. My dad was always dismissed from hospitals because none of his hemophilia treatments could help him when he was young and bleeding. Because we still do not know our type, we can't receive appropriate treatment. He uses medicines that are not very effective and probably even not recommended for our type because that's the only treatment our government can provide. And that just adds to his disability status. I have the same amount of factor VIII in my blood as anyone with mild hemophilia, but I can only receive some factor concentrates through hospital in very serious cases, such as surgeries or tooth extractions. And I always have to argue with doctors that I deserve it. Healthcare system is not able to identify my problem, even after I have spent 10 years of my life trying to change that. When we were diagnosed, my parents were advised to keep us at homeschooling. Doctors were very pessimistic about our future. My parents bought a country house and moved away from capital city and worked very hard to provide us. It was never easy. Country means a lot of physical work. We were raising our own food and building our home. Imagine the stress my parents had. Anytime something could happen and nothing could be done to stop bleeding effectively. My parents were able to get us into schools and we got our education. Actually, all three of us managed to get master's degrees in various areas, but that was always accompanied by bleeding episodes, regular nosebleeds, bleeding from accidental cuts, various bruises. Parents of other kids still tell me, as the leader of their community, that they receive bad comments about their kids who are always covered in bruises. Sometimes social workers are involved to investigate domestic violence. But that's just our blood. We can have bruises with no physical reason. Teachers are often afraid of us. If something happens, it could be lots of blood. Therefore, although now it's recommended, back then when I was in school, we did not do any sports just because schools wanted to keep us safe and avoid risks. So I learned to avoid every risk in my life to keep myself safe. For hemophilia, we as patient organization have managed to advocate for everyday treatment so these kids can grow up and live as everyone. But that is not the same for von Willebrand. Even key doctors consider the treatment too expensive for those kids who bleed regularly and suggest other therapies except those which would stop the bleeding. Some women with von Willebrand receive iron or hormone therapies instead of treatment that would stop from bleeding heavily. No, that would stop them from bleeding heavily during menstruations. There are so many challenges in adulthood. One of the indicators in Sustainable Development Goals is maternal mortality rate. That is one of the indicators that can be easily minimized if all women with bleeding disorders were diagnosed timely. Our family went through a very sad situation. My sister had a baby, and despite knowing that she has von Willebrand's, doctors could not prepare a treatment plan for her delivery. It is important because our risks for bleeding at childbirth or after that are 10 times higher than the average. My sister was very close to dying from a bleed exactly a month after having a baby. Only last year, we adopted guidelines how to treat pregnant women with bleeding disorders in Latvia. And only now, at age 37, she finally got some essential medicines that helps to reduce the bleeding during menstruation. Suffering every month is not an option. It sometimes means even days of work, not to speak about depression and stigma. I joined Women's Committee at World Federation of Hemophilia to raise awareness of women with bleeding disorders, improve diagnosis and care globally. You cannot imagine how challenging it is. Everyone thinks hemophilia is male-only disease. Nobody cares about their mothers, sisters, and daughters. Not many of them know they experience abnormal bleeding. And if they do, they see a doctor who dismisses it because only men could have hemophilia, right? 1/3 of women with bleeding disorders in Europe chose not to have children. We are afraid that we will not get the medical care and the society will point to us because our children can inherit the disease. When genes mutate unexpectedly, it is a different burden than when you know there is a 50-50 chance that you will have a healthy baby. I have no kids, and now it's probably too late. I'm nearly 40. I thought I will live fast and die young. But for past 12 years, I'm the patient voice in my country, standing up for people with bleeding disorders and rare diseases in general. Unlike in Western Europe, it's not common that government would support patient organizations. My family still supports me. I cannot earn a living by being a patient advocate. We have to compete for funding with every other nonprofit organization. I also do not qualify for disability status. Therefore, I receive none of those benefits. Patient advocacy is considered to be a fancy hobby, but each of my peers are parents themselves or patients, and that is the only reason we speak up and demand change. There are no immediate results. Many of us lose health during the battle. Everyone thinks rare diseases affect small proportion of a population, but we calculated that nearly 90,000 people could be affected in Latvia, the same amount as those with cancer, and only 14,000 are identified so far. Half of rare diseases in Latvia affect 1 or 2 persons. They will never establish an organization to fight for their needs and will suffer alone. We need organizations like United Nations to support our efforts to help these people be heard. Not every story will be the same. There is huge variety in health conditions and necessary care. Most of rare diseases are so serious there will never be a cure. Others could be managed as mine. Some need specific support. Would it be treatment or access to specific social services or education? Within existing health and social care systems, we cannot receive what we need. We dream about flexible and personalized solutions to have equitable opportunities. Our health, welfare, happiness rely on understanding and support of broader community. Thank you.